Association of Business, and I'm proud to be here with these fine legislators and other associations to talk about licensed dental hygiene practitioners, LDHP. Health insurance and health care is always a #1 or 2 issue for our members. They struggle to provide insurance for themselves and for their employees. And this is a way in which we can help them in that struggle, and we can help all Texans, because everyone needs dental care. For us, when we evaluate legislation, it's always about access and affordability. And this gets a 100% rating on both access and affordability. It is a common sense approach to solving a problem which is a very serious one in Texas. And I'm proud to introduce one of the sponsors, Representative Symphonia Thompson.
I want to tell you that this is a very important piece of legislation to me as well. You know, I know that we have more than 4 million adults right here within our states, and about 1 million of those persons have to be senior citizens, and about 2 million of them make up about kids all over our states who have untreated dental needs. This bill is the right direction. We're moving forward in the right direction, not only to be able to address the issues of these individuals, but to be able to have a system in place where persons can be able to access good dental care and good dental health care. You know, when I think about persons within my district, they started having a toothache, a pain. The first thing they do if they don't have insurance, or dental, particularly dental insurance, and they can't go to a dentist because they don't have to have the money, they go through the emergency room. And I'm a person who happens to pay hospital district taxes in Harris County. And that means that my taxes goes up because that person has access to the emergency room for something like pain. And if you're talking about pain in your mouth, it's real pain. And I know if there's ever anyone who had a toothache in their life, they know really the results of it. We had in 2013, we had about $14 million that was spent on emergency care. That's a lot of money. It can go a lot of different ways all over the state and be able to help a person to be able to access dental care in a more reasonable, cost-efficient, and yet effective method and ways for them. And this looks like that this bill is a solution to a problem that is begging for an answer. And I know that our solution closes some gaps within the dental area. It makes sure that more people have access to dental care. The costs to the state and taxpayers are smaller, and we'll be able to stretch the dollars far more. We're going to be able to put more people in rural areas to be able to have access to dental care all over our state of Texas. This particular bill has broad bipartisan support. It saves the state money, it creates jobs, it helps children, families, seniors in need in every one of our districts. And I'm proud to sponsor this bill, and I'm proud that my good colleague, Senator Jose Rodriguez from El Paso, is the author of the bill in the Texas Senate. Please allow me to introduce my friend, my colleague, Senator Jose Rodriguez.
Thank you very much. What is it, afternoon? No, not, yes, it is afternoon. Good afternoon. Representative Thompson and other members who are here with us. You know, this is an occasion that we ought to be celebrating. We've got a bipartisan group of legislators and advocates that are here to address this issue, because we all know that access to dental care is a problem in every corner of our state. Whether you live in El Paso or Corpus Christi, Dallas, Austin, Lubbock, Amarillo, we find the same thing. Whether you're elderly, as the representative said, if you live in a rural or inner city community, if you don't have insurance or you're on Medicaid, it's tough to find a dentist, especially one that you can afford if you're on Medicaid or uninsured. Now consider this, in my own district, I represent El Paso, large urban community, but I also represent 4 far west Texas counties: Presidio, Jeff Davis, Culberson, Hudspeth. 3 of those counties, by the way, do not have a single dentist. Not a single dentist, not one. Now, that is not limited access to dental care. That's no access to dental care. And so this is just in my district. It's a problem in every part of the state. And that is why you have sponsors up here from across the state, from both political parties. We have to do something about this problem, because when our friends and neighbors can't find a dentist, as we just heard, they go to the emergency room for care, and that ends up costing all of us. The representative just gave us an example of that. And what excites me about this particular proposal is, Bill Hammond, is that it's a job creator. All right? It improves access to dental care, saves the state money and taxpayers money, and we create jobs while doing it. And here's how that would happen. Our bill would create an additional career pathway for already licensed dental hygienists in the state so that they can improve their education, earn more money, and find jobs treating more of our children, families, and seniors who need the dental care. It helps out dentists too, who will have greater freedom to expand their practice, adding to their bottom line and spurring economic growth in areas that need it. So today you see legislators from both sides of the aisle and from every region of our state standing in support of this approach. It speaks volumes about the common sense way we address this problem of dental care access with this bill. Finally, it provides Texans much needed access to oral health care. It's free market, it cuts red tape, it improves the bottom line for dentists without sacrificing patient care, it saves the state money, and it helps a lot of Texans in need. So we need this bill, and we are here to get the support from everyone in this Capitol, including the governor, so that we can provide more access to dental care. Thank you all. Now, who are we going to come up next?
Okay.
Representative?
How are you?
Thank you, sir.
Senator, how are you doing? All right, hi, I'm Jim Keffer from Eastland, Texas. Did everybody floss today?
Yes.
Now, one of the reasons, or the reason that I am supporting this bill is what it means to rural Texas. 60% of Texas counties don't have enough dentists. 20% of Texas counties don't have dentists at all. Nearly 6 out of every 10 Texas children have experienced dental decay. More than 1/4 of our kids have untreated decay. Kids with untreated decay not only suffer pain and infection, they also have trouble eating, talking, sleeping, and learning, which directly affects their performance in school and cause missed school days. All of this costs school districts money. My wife is a former school teacher, and I know the challenges that our school face. Poor student performance because of toothache should be one of them. But this problem isn't limited to our kids. Lack of access to dental care affects all Texans, not just our teeth, but it also hurts our wallets. Ms. Thompson was talking about the visits to the emergency room. 51,000 Texans visited emergency rooms for dental problems in 2013. Total cost, $14 million. This is unacceptable. And to make a bad situation worse, it is not only going to get worse because 1,000 people a day are moving into our state, expecting to encounter the Texas Hope. And one of those situations, we want them to be out throughout Texas. And if we're going to be able to do that, we have to have medical care and of that dental care. And we need to do something now. Texas taxpayers are tired of spending millions of dollars when we can go about this in a smarter way. House Bill 1940 and Senate Bill 787 provide a common sense approach, allowing dental hygiene practitioners to provide routine dental care under the supervision of a dentist is a free market solution and a win-win for Texas. Patients will have an easier time getting care, and dentists will have greater flexibility to expand their practice. I look forward to voting yes on House Bill 1940 because it will benefit rural Texas and all Texans across the state. Thank you again for being here, and I'd like to ask Mr. Paul Blair with Americans for Tax Reform to be our next speaker.
My name is Paul Blair, and I'm with Americans for Tax Reform. We are a taxpayer advocacy organization founded in the mid-'80s by Grover Norquist, who continues to be the president of our organization. We became interested in this issue a number of years ago when debate took place in Minnesota about the same sort of dental reform at the mid-level. 2009, that bill passed before the Affordable Care Act was passed into law, and then a number of years later, the debate took place in Maine. The Democrat-run legislature passed a bill, and Republican Governor Paul LePage signed it just last year. So this certainly is a bipartisan issue that has the potential to help states, including Texas, realize millions of dollars in taxpayer savings. As has been mentioned, an individual who shows up to the ER, who shows up to the hospital with significant needs, whether it's because they didn't seek the preventative care at dentists or small businesses that they may have needed, hospitals are required by law to treat those patients, and so whether they have insurance or not. Now, this stands to potentially save taxpayers millions of dollars, not only for those who show up to the hospital in need of emergency services, but private businesses who, for example, serve patients and consumers with Medicaid do so at less of a cost by allowing these mid-level providers to provide services as outlined in Senate Bill 787 and House Bill 1940. So we're proud to support this legislation because it's very similar to what happened decades ago with nurse practitioners. Physicians began working and collaborating with nurses who had clinical experience, as this legislation requires, to fill a void left by specialization in the medical field. Now, today, nurse practitioners provide the same level of care provided by physicians, and this mirrors what was a very significant debate in the 70s that resulted in a win for both taxpayers, private businesses, and the public. And so Americans for Tax Reform is proud to support both House Bill 1940 and Senate Bill 787 because this is a win for taxpayers, and it's also a win for private businesses and the state. Thank you.
Good afternoon. My name is Chris Yanis, and I'm here today on behalf of Methodist Healthcare Ministries of South Texas to show our support for Senate Bill 787 and House Bill 1940. We are a faith-based, non-for-profit organization that provides medical, dental, and health-related human services to low-income families and the uninsured throughout South Texas. Our mission is to improve the mental, physical, and spiritual health of those least served through the Rio, Texas Conference area of United Methodist Church, which spans 74 counties across South Texas. Here's the area we cover all the way up to Lincoln County, Sterling County, all the way down to the valley. We are also 50% owners of the Methodist Healthcare System, the largest healthcare system in South Texas. Our unique partnership allows the Methodist Healthcare System to provide quality care to all, charitable care when needed, and it also provides revenue for the ministries to provide its programs. The social principles of the United Methodist Church are the foundation for our belief that healthcare is a basic human right. And we certainly recognize that the role the government plays in ensuring individual access to health care. We believe that a holistic approach to health, treating the whole person, mind, body, and spirit, with prevention being the foundation, is essential to creating and sustaining healthy communities. Dental care is a fundamental component of healthcare needs, which is why we offer dental services in our own clinics and that we operate in Bexar County, as well as other sites throughout the state, through community grants to our nonprofit partners. Since 1996, Methodist Healthcare Ministries has awarded more than $38 million in grant funds for dental and oral health care. We funded an additional $5.6 million to run our own dental clinics and provide comprehensive dental care. We have a beautiful state-of-the-art dental clinic in the middle of South San Antonio, in the middle of the neighborhood. The second level has got state-of-the-art labs, state-of-the-art equipment. We create our own dentures. We mold and create our own dentures for the elderly. It is a beautiful facility, and I would welcome you all to come tour that. In 2015 alone, Methodist Healthcare Ministries will distribute $4.3 million for dental services to 17 of our nonprofit partners across South Texas. Our board of directors and our CEO believe this investment is important if we are to increase access to care. Senate Bill 787 and House Bill 1940 seek to improve access to dental care and oral care in Texas by expanding the number of dental hygiene professionals and dentists in the state. If passed into law, this legislation would greatly improve access by allowing community health centers to expand their dental practices. More access means better care at the right place, at the right time, at the right price. Emergency rooms are not the right place, nor do they provide the care at the right price. We know this, and yet our ERs remain crowded and overused for medical care that could have been avoided. As has been said, our rural communities will greatly benefit from this legislation. There is a significant shortage of providers in all areas, but especially the rural counties. Our community partners are consistently experiencing challenges in securing qualified dentists for their practices. Senate Bill 797 and House Bill 1940 would go a long way to alleviate some of these challenges. For example, some of the dentists that are recruited are secured through work visas, which require an initial investment of up to $20,000 in order to attract these providers. These arrangements, however, are usually only short-term, since our practitioners stay less than 2 years on average due to the high demand and competitive process for their services. The number of patient slots one dentist can reasonably schedule and treat is limited. Additional mid-level practitioners would increase access for those patients. There's often lengthy patient backlogs for these dentists. Often it's 3 months, and it can go as long as up to 6 months. Many of Methodist Healthcare Ministries' funded partners already employ mid-level practitioners with great success. We find patients respond well to mid-level providers. In general, access is improved, and we find there is no compromise in the quality of care provided to their patients, and the cost of care is significantly lowered. We anticipate the same positive outcomes would be realized with the passages of Senate Bill 797 or House Bill 1940. We encourage Chairman Schwartner and Chairwoman Crownover to assist stakeholders in finding common ground that will ultimately lead to a bill that is agreed to by all and get us down the path of increasing access to dental care for all Texans. Thank you.
Just wanted to say one quick word. Oral health care is important, not just in your mouth, but all the other things it does for your body. And it protects you from other diseases. I think that's the most important thing that we can think about today, is how important oral health care is to your total health. And that's why I'm supporting this bill.
Thank you, Mr. Rainey. I want to thank all the participants here today. We certainly appreciate their leadership and support for this issue, and they or I will try to answer any questions if you have any. Or have we beat it to death?
No. Where does the bill stand right now? Has it been referred at all? Sorry for me not looking.
House Bill 19 and 40 has had a hearing and is still in committee, and I'm hopeful that it will get voted out, sent to the Calendars Committee.
Yes, sir.
It says here in the packet that they would, dental hygiene practitioner would still have to be under the supervision of a dentist. So with that in mind, how is the bill going to increase dental care access in rural counties, because you still need a dentist to have a practice?
Well, it's the network. It's the network it is set up. You know, you have a dentist, but he can have a network of practitioners out in different counties that he oversees or, supervises, but that network that they've set up greatly expands what dental care can be had in rural Texas.
Would they have to come, would the dentist, and maybe it's just with a nurse and you're seeing a doctor, oftentimes they do most of the exam and then the doctor still comes in, would the dentist still have to come in?
I think it's probably routine. I mean, I would think it would probably be that kind of, the network, but I'm sure the dentist would at times come through the whole district or the oversee or the network that he has. But, it would be, again, the great thing about it is, like nurse practitioners, we're able to go out into the rural counties, we're able to go out and have care where right now we haven't.
Once a year.
Stephanie has to say something.
The dentist will need to see the patients at least once a year unless determined by patient record reviews and telemedicine that it's appropriate to continue just the preventative care.
Any other questions? Stephanie, any points that we missed?
I think y'all are right on target. It meets the need, it's evidence-based, and it creates jobs as an arm extension
Win,
for
win,
the
win,
dentist. Win-win-win.
And it's bipartisan.
And it's bipartisan.
Great.
Thank you.